Hello and namaskar, good evening, walaikum salam. Myself, Dr. Ashok Kapoor, cardiologist at Getwell Medical Center and Medical Clinic Group, UAE, Dubai. I am once again back with you to discuss important medical aspects that affect the general public. It's for public audience, but of course the technical, medical and paramedical staff also can gain a lot, because we will start a series of presentations where we will discuss a lot. And the very first one which I am going to present today is be a lifesaver. They say the God is the only one who can give you life and save your life and take your life. But sometimes in the hands of medical professionals, a layman or anybody, the God gives you power, the privileges to save a life who is passing away or who is dead in front of you. So sudden cardiac death we keep on hearing a lot. It can happen in the hospital in a disease sick patient who is already admitted, or it can happen suddenly in the play field, playground, cricket ground, football ground, in the bus station, in the school, in the college, institution, hotel, restaurant, anywhere. A person suddenly drops down. It can be witnessed by many. And if you have been with our video system, what we are going to explain today, you can definitely be a lifesaver. You must have heard what we say cardiopulmonary resuscitation, CPR, do CPR. Basic life support, BLS. So every individual actually, whether he is professional or non-professional, should try to learn, because it can happen in your home, in your family. Suddenly anything happens, you can be a lifesaver, real lifesaver of your close, nears and dears. So this is what we will go step by step and in a very, very layman form. Very layman form, very simple, will not add very high technology, because you don't need any medicine. For BLS, CPR, you need yourself, your friends, maybe all around you who is available to support you. And of course, in front of you, a body or a dead body, almost a dead person is there, whom you have to bring back to life. So that's why we call this start as be a lifesaver. Listen to our video and keep on subscribing our channel, so I'll to give you, impart to you more and more knowledge with time. Very simple things can make a lot of difference in life, and this is what this video will say. So what happens suddenly, a person in front of you, suppose you find suspicious that he is not breathing, he is almost unconscious. So any unconscious person, any unresponsive person, the first and foremost objective is to confirm that he is not just lying down, he is unresponsive. He doesn't have pulse, his heart is not beating, and he is not breathing. So this is what is called as the cardiac arrest. So how to know about this? You need not be a very highly qualified, experienced doctor or professional to decide this factor. Just if you are trained with BLS or CPR, you can do that. So just the person is flat on the ground. Suppose I am talking of a scenario outside the hospital, and you just happen to be there. So just go near to him. Don't be afraid. Don't be frightened. And just first of all, try to find out whether the breathing is there. So just go very close to the person's mouth and nose and try to hear the voice or the sound of breathing that's coming there. And simultaneously you try to palpate just little to the neck. On the neck side, in the muscle area, there's a groove. A big artery is there which will normally pulsate in life. So if both are absent, the patient is unresponsive, you just tap on his shoulder very forcefully. Of course, not making him too much movement, but just he should feel it. Are you all right? Are you all right? Are you okay? Just 2-3 words. If he doesn't respond, here for the breathing, Try if you can see the pulse. Within 10 seconds you have to decide. You have just 10 seconds with you to decide whether the patient has gone into cardiac arrest or not. And these three signs are sufficient. Non-responsive, no pulse on the neck, on side of the groove of the muscle, and no breathing hard. So just staying. I will of course simultaneously keep on displaying what is I am trying to explain, and in a depictive form, in a graphical form, will display also practically everything what I am speaking. So if these three evidences are not there, non-responsive, non-pulsatile, no pulse, no breathing, you have immediately to take some action, call for help. Please help, please help. If anybody knows BLS, he will be coming to your help as a rescue. So you will form a rescue team if the second person is available, and tell the other rescuer to inform 911 or 999 as the hotline for the medical ambulance or EMS services or emergency medical services available. And you start the job, and that job is simple. We used to call it ABC before, but now we call it CAB. CAB means chest compressions. C stands for chest compressions, A stands for the airway, and B stands for the breathing. So the chest compressions are the most important aspect of the life-saving procedure which you are going to pursue on that person. So the chest compressions have to simply be done on the body
to give
of
CPR,
the person.
this
You
is
be
what
on
to do.
the side at
The
this
casualty
level,
should be lying on their back
and
on a firm surface.
the
There's no need to
one
remove any clothing. Kneel
part
beside
of the
them,
palm
level
of
with
the
their
heel of
chest.
the hand has to be
Tilt the
kept
head
on
back
the
to-
middle bone, which is called the breastbone or the sternum, on the lower part in between the two nipples in the center, and the second has to be kept
Keep the airway open.
over the
Lean
first,
over
and
the
then you
casualty
lock
with your
it,
arms straight.
and then start
Place
compression
the
of the
heel of
chest.
one of your hands in
Be
the center
very
of their
good with your
chest, in
compressions
line
and
with their
very
nipples.
smooth with the compressions,
Place the
and the
heel
rate has
of
to
your
be
other
very
hand
fast.
on top of
It has
your
to be
first
100
hand
to 120
and
per
interlock your
minute at
fingers.
least,
Try to keep
like
your
this.
hands away from their
So you
rib
have locked
cage.
this finger, and with the one heel and the second heel on the above the other, and the locked,
So
and
you
so
won't be
that,
pressing down
and
on
then
the
keep
casualty's
this
ribs.
hand
Keeping your arms straight,
at the elbow
press down
straight. So the
vertically
main
about
thing
4
has
to
to be
6
from the shoulder.
centimeters, which is about a
1,
third of the
2,
depth
3,
of the
4,
chest.
5, 6, 7, 8, 9, 10. So you keep on counting, because you need to deliver at least 100 to 120 per
Release the pressure
minute of the
without
compression.
removing your
But
hands
make
from
sure
their
that
chest.
between the compression you
Allow
are
their
away
chest
from,
to come back
or you
up
have just
fully.
released
This is one
the breastbone, so
compression
that the
before
heart,
giving the
after
next
being
compression.
squeezed
Compress their
of the
chest
blood,
30
needs
times
again the
at a
blood
rate
to
of
come in.
about
So a
twice
vacuum
per
is
second.
created by this process, and the blood from the venous system and from the other areas again comes back and fills the heart. So every time you press the heart, every time you release it, and keep on doing it. So it has to be fast and forceful. Fast and forceful. Sometimes it may be that forceful that it may, of course, cause small fractures on the ribs, but that are not an issue in the long term. They heal on their own, but you save the life. So you are ready for that. But if you are smooth in your action, nothing of that sort will happen, and the heart will be pumped 100 to 120 times per minute, as the way I explained to you. So this process has to continue at least for 2 minutes. First time when you have started, it has to continue for 2 minutes, and in the meantime the rescuer will keep on doing what we have discussed. He will inform the EMS system and the help may arrive, but you don't have to wait for them. The rescue team has to arrange for a defibrillator and other thing which will be done, but after 2 minutes, if you are all alone, you need to give some care of the airways. Airways means from the air goes from the nose, larynx to the lungs. So for 2 minutes, there is a sufficient air in the lungs to take care. But after that, you need extra air for the oxygenation of the body system, because the blood carries the oxygen. So if the lung don't have oxygen, from where the oxygen will come to that blood which you are pumping? So you have done the job for 2 minutes, and you start looking at the airway. You start looking at the airway, and you have to do some procedures to make open the airway. The procedures are called as the jaw thrust, face thrust, and of course the jaw lifting process is there, which I'll explain in the extra video in a different way. But that is also an important part to open the airway. So it can be head tilt and the jaw tilt or jaw thrust procedure to open the airways, so that you can put the third part is the breathing, CAB. First is circulation, second is airway, and third is breathing. You have a mask available, but in the meantime the EMS comes and the mask is available, because most of the people are reluctant now to give the mouth-to-mouth breathing. But the mask is there, so the mask you can give the breathing. But from the COVID onward, the mouth-to-mouth breathing is not very popular. But if you are doing compression of the chest, that is sufficient sometimes till the mask or a bag and mask comes, and then you put it on the face of the person to give him the extra breathing, which are 2 breaths every 30 compressions. 30:2 is the best ratio. You press 30 times the chest for the heart compressions, and then while the compressions are going on, you give the 2 breaths. Let the air simplicity be there, but the 2 breaths should be able to inflate the chest and give sufficient air for the oxygenation to happen. So this is taking care of the cardiac arrest by giving the circulation by cardiac compression or chest compression. Airway is taken care of by positioning and aligning the airway so that it remains open. And breathing is given. Once upon a time it was mouth to mouth, but nowadays we depend upon the mask breathing and bag valve mask breathing to start with. And they are very advanced methodologies to which we come later on when the patient is shifted to a proper in-hospital or in the ambulance, where advanced cardiac life supports facilities are available. So basically try to become a lifesaver, be a lifesaver. So a person can drown in front of you, a person can be in the fire area, in any area, fall down, trauma, toxicity, drugs, heart attack, you name it, any disease can give rise to cardiac arrest ultimately. So I'll stop here today. We'll continue further because there are a lot of things to be explained still in this situation. So I'll keep on explaining in the different videos as I come, because I don't want to prolong it, but try to listen to this video many times and see what has come to your mind. I'll try to depict it graphically also, so that at least you assimilate more and more of what we are speaking. Try to become more practical, and then you can start practicing on the mannequins which are available, or at least seeing itself the practice is there. And then if any questions, please come to us directly, and I'll request you that series of presentations will be there which will be very fruitful in your life in all the ways, in many ways, where we will talk professionally in a layman terminology. So please subscribe to our channel, be in touch with us, and press the bell icon if you like it, and share the video with your friends, with your WhatsApp groups, and in your social media. Have a nice time, be healthy, and be very, very healthy. Thank you so much.